Welcome to the Life Science Coach. In today's lecture, we will explore one of the most important endocrine glands in the human body, the thyroid gland. Although small in size, the thyroid plays a crucial role in regulating metabolism, growth, energy production, body temperature, and overall physiological functions. Before diving into the topic, let's understand what we aim to achieve in this lecture. By the end of this session, you should be able to explain the anatomy and normal functions of the thyroid gland and understand why it is considered one of the body's most important endocrine organs. You will also learn how thyroid hormones are synthesized, secreted, and regulated through the Hypothalamus-Pituitary-Thyroid axis. A major objective of this lecture is to clearly differentiate between hyperthyroidism and hypothyroidism. Many students find these conditions confusing, but by understanding their mechanisms and clinical manifestations, distinguishing between them becomes much easier. Additionally, we will discuss the causes, signs, and symptoms, and diagnostic approaches used to identify thyroid disorders in clinical practice. Finally, we will explore the treatment and management strategies available for both hyperthyroidism and hypothyroidism, along with important exam-oriented points and clinical correlations. Now let's begin with an introduction to the thyroid gland. The thyroid gland is a small, butterfly-shaped endocrine gland located in the front of the neck, just below the larynx, commonly known as the voice box, and in front of the trachea or windpipe. Although it is relatively small in size, the thyroid has a major influence on nearly every cell in the body. It produces two important hormones, triiodothyronine, T3, and thyroxine, T4. These hormones help regulate the body's metabolic rate, which determines how quickly the body uses energy. The thyroid gland also plays an essential role in growth and development, maintaining normal body temperature, supporting brain function, regulating heart rate, and controlling energy production. Because of these critical functions, any imbalance in thyroid hormone production can significantly affect overall health. Too little hormone production leads to hyperthyroidism, while excessive hormone production causes hypothyroidism. Therefore, understanding the thyroid gland is the first step toward understanding thyroid disorders and their impact on the human body. Now let's take a closer look at the anatomy of the thyroid gland. The thyroid is a butterfly-shaped gland located in the anterior part of the neck. It lies just below the larynx, or voice box, and in front of the trachea, commonly known as the windpipe. Structurally, the thyroid gland consists of two lateral lobes, the right lobe and the left lobe. These two lobes are connected by a thin bridge of tissue called the isthmus, which crosses the front of the trachea. The gland has a rich blood supply, receiving blood mainly from the superior and inferior thyroid arteries. This extensive vascular network is important because thyroid hormones are released directly into the bloodstream and transported throughout the body. At the microscopic level, the thyroid is composed of numerous spherical structures called thyroid follicles. These follicles store a protein-rich substance called colloid, which serves as a reservoir for thyroid hormone production. Because of its strategic location and highly specialized structure, the thyroid gland can efficiently synthesize, store, and release hormones that regulate metabolism, growth, and energy balance. Now that we understand the structure of the thyroid gland, let's discuss the hormones it produces and their functions in the body. The thyroid gland primarily produces two hormones, triiodothyronine, T3, and thyroxine, T4. T3 contains 3 iodine atoms and is the biologically more active form of thyroid hormone. T4 contains 4 iodine atoms and is produced in larger quantities. Most of the T4 is later converted into T3 in body tissues, where it exerts its physiological effects. In addition to T3 and T4, the thyroid gland also produces calcitonin, a hormone involved in calcium regulation. Calcitonin helps lower blood calcium levels by promoting calcium deposition in bones. The major functions of thyroid hormones include regulating metabolism, increasing energy production, supporting growth and development, maintaining normal body temperature, and influencing heart rate and cardiac function. Because thyroid hormones affect almost every cell in the body, any imbalance in their levels can lead to significant health problems. Low hormone levels result in hyperthyroidism, while excessive levels cause hypothyroidism. Now that we know the thyroid gland produces T3 and T4 hormones, an important question arises: how does the body control the production of these hormones? The answer lies in the hypothalamus-Pituitary-Thyroid axis, commonly known as the HPT axis. The process begins in the hypothalamus, a region of the brain that releases TRH, or thyrotropin-releasing hormone. TRH then travels to the anterior pituitary gland, stimulating it to release TSH, which stands for thyroid-stimulating hormone. TSH enters the bloodstream and reaches the thyroid gland, where it stimulates the synthesis and release of T3 and T4 hormones. These thyroid hormones then act on various target tissues throughout the body, regulating metabolism, growth, energy production, body temperature, and heart rate. An important feature of this system is negative feedback regulation. When blood levels of T3 and T4 become sufficiently high, they signal the hypothalamus and pituitary gland to reduce the release of TRH and TSH. This prevents excessive hormone production and helps maintain hormonal balance. Similarly, when thyroid hormone levels fall, the hypothalamus and pituitary increase TRH and TSH secretion, stimulating the thyroid gland to produce more hormones. Thyroid hormone synthesis is a multi-step process that requires iodine and specialized thyroid follicular cells. The first step is iodide uptake, where iodide ions from the bloodstream are actively transported into thyroid follicular cells through the sodium iodide symporter, often abbreviated as NIS. Next, the iodide is transported into the follicular lumen, also called the colloid. Here, the enzyme thyroid peroxidase, TPO, converts iodide into active iodine through a process known as oxidation. The activated iodine then binds to tyrosine residues present in a protein called thyroglobulin. This process is called organification or iodination and forms two important intermediates, MIT, monoiodotyrosine, and DIT, diiodotyrosine. The next step is coupling. One MIT combines with one DIT to form T3, triiodothyronine, 0.2 DIT molecules combine to form T4, thyroxine. These hormones remain stored in the colloid attached to thyroglobulin until the body requires them. When stimulated by TSH, the thyroid cells take up thyroglobulin through endocytosis. Proteolytic enzymes then release T3 and T4 from thyroglobulin, allowing them to enter the bloodstream and reach target tissues throughout the body. This entire process ensures a continuous supply of thyroid hormones necessary for normal metabolism and growth. Hypothyroidism is a condition in which the thyroid gland does not produce enough thyroid hormones, particularly T3 and T4, to meet the body's needs. Since thyroid hormones are responsible for regulating metabolism, energy production, growth, and many vital body functions, a deficiency of these hormones causes the body's processes to slow down. Think of thyroid hormones as the body's metabolic accelerator. When hormone levels decrease, the body's engine begins to run more slowly. As a result, individuals with hypothyroidism often experience fatigue, reduced energy levels, weight gain, cold intolerance, constipation, dry skin, and a slower heart rate. Hypothyroidism can occur at any age, but it is more common in women and older adults. It may develop gradually, and symptoms often appear slowly over time, making early diagnosis challenging. Fortunately, hypothyroidism can be effectively managed with thyroid hormone replacement therapy when diagnosed early. Hypothyroidism occurs when the thyroid gland fails to produce sufficient amounts of thyroid hormones. This condition can develop due to several underlying causes affecting the thyroid gland itself or the hormonal control mechanisms that regulate thyroid function. The most common cause of hypothyroidism in adults is Hashimoto's thyroiditis, an autoimmune disorder in which the body's immune system attacks the thyroid gland, gradually reducing its ability to produce hormones. Another important cause is iodine deficiency. Since iodine is an essential component of thyroid hormones, inadequate iodine intake can impair hormone synthesis and lead to hypothyroidism. Hypothyroidism may also develop following thyroid surgery, where part or all of the thyroid gland is removed, resulting in reduced hormone production. Similarly, radioactive iodine therapy, commonly used to treat hypothyroidism or thyroid cancer, can damage thyroid tissue and decrease hormone secretion. Certain medications such as lithium, amiodarone, and interferon alpha may interfere with thyroid hormone production and contribute to hypothyroidism. Less commonly, disorders of the pituitary gland or hypothalamus can reduce the secretion of TSH or TRH, leading to decreased stimulation of the thyroid gland and reduced thyroid hormone production. In some individuals, hypothyroidism is present from birth due to congenital abnormalities of the thyroid gland, a condition known as congenital hypothyroidism. The symptoms of hypothyroidism develop because thyroid hormones are responsible for maintaining the body's metabolic rate. When hormone levels decrease, most body functions begin to slow down. One of the most common symptoms is persistent fatigue and a lack of energy. Patients often feel tired even after adequate rest and may experience reduced physical and mental activity. Weight gain is another characteristic feature. Since metabolism slows down, the body burns fewer calories, leading to gradual weight increase despite no major changes in diet. Individuals with hypothyroidism frequently experience cold intolerance and may feel unusually cold even in warm environments. This occurs because reduced thyroid hormone levels decrease heat production in the body. The skin may become dry and rough, while hair may become brittle and fall out more easily. Some patients also develop puffiness of the face and swelling around the eyes. Digestive functions slow down, leading to constipation. The heart rate may also decrease, resulting in a slower pulse and reduced exercise tolerance. Neurological and psychological symptoms can include difficulty concentrating, poor memory, depression, and excessive sleepiness. In severe or long-standing cases, patients may develop significant slowing of physical and mental functions, a condition known as myxedema. The diagnosis of hypothyroidism is based on a combination of clinical symptoms, physical examination, and laboratory investigations. Patients often present with symptoms such as fatigue, weight gain, cold intolerance, constipation, dry skin, and slowed mental activity. However, because these symptoms can be nonspecific, laboratory testing is essential for confirmation. The most important screening test is the measurement of thyroid-stimulating hormone, TSH. In primary hypothyroidism, the thyroid gland produces insufficient thyroid hormones, causing the pituitary gland to release more TSH in an attempt to stimulate the thyroid. As a result, the typical laboratory pattern in primary hypothyroidism is increased TSH levels, decreased free T4 levels. Free T4 is considered the most important hormone measurement for confirming thyroid hormone deficiency. In some cases, free T3 may also be measured, although it may remain normal during the early stages of the disease. To determine the underlying cause, additional investigations may be performed. Antithyroid peroxidase antibodies, commonly known as anti-TPO antibodies, help diagnose Hashimoto's thyroiditis, the most common cause of hypothyroidism. Thyroid ultrasound may be used to evaluate the size, structure, and any abnormalities of the thyroid gland. Early diagnosis is important because timely treatment can prevent complications and improve quality of life. The standard treatment for hypothyroidism is levothyroxine, a synthetic form of the hormone thyroxine, also known as T4. After administration, levothyroxine is converted into the active hormone T3 in body tissues, helping restore normal physiological functions. Treatment is usually lifelong in patients with permanent hypothyroidism. The dosage is individualized based on factors such as age, body weight, severity of the disease, and the presence of other medical conditions. Levothyroxine is typically taken once daily, preferably in the morning on an empty stomach, about 30 to 60 minutes before breakfast. Proper timing is important because food and certain medications can interfere with its absorption. Regular monitoring is essential during treatment. Thyroid-stimulating hormone, or TSH, levels are usually checked 6 to 8 weeks after starting therapy or after any dose adjustment. Once stable hormone levels are achieved, periodic monitoring is continued. Most patients experience gradual improvement in symptoms such as fatigue, weight gain, constipation, and cold intolerance within a few weeks of treatment. With proper treatment and follow-up, individuals with hypothyroidism can lead a normal and healthy life. One of the most characteristic features is unintentional weight loss despite an increased appetite. Although patients eat more, their bodies burn energy at a much faster rate due to increased metabolism. Many individuals experience heat intolerance and excessive sweating because the body generates more heat than normal. The cardiovascular system is significantly affected. Patients commonly develop palpitations, rapid heart rate, and increased blood pressure. In severe cases, abnormal heart rhythms may occur. Neurological symptoms include nervousness, anxiety, irritability, restlessness, tremors, and difficulty sleeping. Patients often describe feeling constantly active or unable to relax. The digestive system also becomes more active, leading to increased appetite, frequent bowel movements, or diarrhea. Muscle weakness may develop, particularly in the muscles of the shoulders and thighs, making activities such as climbing stairs or lifting objects more difficult. Changes in the skin and hair are common. The skin often becomes warm and moist, while the hair may become fine and thin. In Graves' disease, patients may develop characteristic eye changes known as exophthalmos, where the eyes appear prominent or protruding. An enlarged thyroid gland, known as a goiter, may also be present. Hypothyroidism occurs when the thyroid gland produces excessive amounts of thyroid hormones, resulting in an increased metabolic rate and overactivity of various body systems. The most common cause of hypothyroidism is Graves' disease, an autoimmune disorder in which antibodies stimulate the thyroid gland to produce excess thyroid hormones. This condition often causes diffuse enlargement of the thyroid gland and may be associated with eye abnormalities. Another common cause is toxic multinodular goiter, where multiple overactive nodules within the thyroid gland independently produce excess thyroid hormones without normal hormonal regulation. A toxic adenoma, also known as a hyperfunctioning thyroid nodule, can also secrete excessive amounts of thyroid hormones and lead to hypothyroidism. Inflammation of the thyroid gland, known as thyroiditis, may cause the release of stored thyroid hormones into the bloodstream, temporarily increasing hormone levels. Examples include subacute thyroiditis, painless thyroiditis, and postpartum thyroiditis. Hypothyroidism may also result from excessive intake of thyroid hormone medications or excessive iodine exposure in susceptible individuals. In rare cases, disorders of the pituitary gland that produce excess TSH can stimulate the thyroid gland and lead to hypothyroidism. Identifying the underlying cause is important because treatment varies depending on the specific condition responsible for the excess hormone production. The symptoms of hypothyroidism occur because excessive thyroid hormones increase the body's metabolic rate and stimulate multiple organ systems. One of the most characteristic features is unintentional weight loss despite an increased appetite. Although patients eat more, their bodies burn energy at a much faster rate due to increased metabolism. Many individuals experience heat intolerance and excessive sweating because the body generates more heat than normal. The cardiovascular system is significantly affected. Patients commonly develop palpitations, rapid heart rate, and increased blood pressure. In severe cases, abnormal heart rhythms may occur. Neurological symptoms include nervousness, anxiety, irritability, restlessness, tremors, and difficulty sleeping. Patients often describe feeling constantly active or unable to relax. The digestive system also becomes more active, leading to increased appetite, frequent bowel movements, or diarrhea. Muscle weakness may develop, particularly in the muscles of the shoulders and thighs, making activities such as climbing stairs or lifting objects more difficult. Changes in the skin and hair are common. The skin often becomes warm and moist, while the hair may become fine and thin. In Graves' disease, patients may develop characteristic eye changes known as exophthalmos, where the eyes appear prominent or protruding. An enlarged thyroid gland, known as a goiter, may also be present. Graves' disease is the most common cause of hypothyroidism and is an autoimmune disorder affecting the thyroid gland. In this condition, the immune system produces antibodies called thyroid-stimulating immunoglobulins, TSI. These antibodies bind to TSH receptors on thyroid cells and continuously stimulate the gland to produce excessive amounts of T3 and T4 hormones. As a result, the thyroid gland becomes overactive, leading to hypothyroidism and increased metabolic activity throughout the body. Graves' disease is more common in women, particularly between the ages of 20 and 40 years. Genetic factors, stress, infections, and smoking are known risk factors that may contribute to its development. One of the hallmark features of Graves' disease is a diffuse goiter, which is a uniform enlargement of the thyroid gland. Another characteristic feature is exophthalmos, where the eyes appear prominent or protruding due to inflammation and tissue expansion behind the eyeballs. Patients may also experience eye irritation, redness, dryness, and discomfort. Common symptoms include weight loss despite increased appetite, heat intolerance, excessive sweating, tremors, palpitations, anxiety, irritability, and muscle weakness. Laboratory findings typically show low TSH levels, elevated free T4 and free T3 levels, positive TSH receptor antibodies. If left untreated, Graves' disease may lead to serious complications such as cardiac arrhythmias, osteoporosis, and thyroid storm, which is a life-threatening endocrine emergency. The diagnosis of hypothyroidism is based on clinical symptoms, physical examination, and laboratory investigations that demonstrate excessive thyroid hormone production. The most important initial test is the measurement of thyroid-stimulating hormone, TSH. In hypothyroidism, elevated levels of thyroid hormone suppress the pituitary gland through negative feedback, resulting in very low or undetectable TSH levels. The typical laboratory pattern of hypothyroidism includes low TSH, elevated free T4, elevated free T3. This combination confirms excessive thyroid hormone activity. In suspected Graves' disease, testing for TSH receptor antibodies, also known as TIB, helps confirm the autoimmune nature of the disorder. Additional investigations may be performed to identify the underlying cause of hypothyroidism. A radioactive iodine uptake (RIU) test measures how actively the thyroid gland absorbs iodine. In Graves' disease, radioactive iodine uptake is diffusely increased throughout the gland. In toxic nodules, uptake is localized to specific overactive areas. In thyroiditis, uptake is typically reduced because excess hormones are being released from damaged thyroid tissue rather than newly synthesized. A thyroid scan or scintigraphy provides a visual image of thyroid activity and helps differentiate various causes of hypothyroidism. Thyroid ultrasound may also be used to assess thyroid enlargement, nodules, and blood flow patterns. Accurate diagnosis is essential because treatment depends on the specific cause of hypothyroidism. The primary goals of hypothyroidism treatment are to reduce excessive thyroid hormone production, relieve symptoms, prevent complications, and restore normal thyroid function. One of the main treatment options is the use of antithyroid medications. Drugs such as methimazole and propylthiouracil inhibit the synthesis of thyroid hormones and help control hormone levels. These medications are often used as the first line of treatment, particularly in Graves' disease. While antithyroid drugs reduce hormone production, they may take several weeks to achieve their full effect. Therefore, patients are often given beta blockers such as propranolol to provide rapid relief from symptoms like palpitations, tremors, anxiety, and rapid heart rate. Another important treatment option is radioactive iodine therapy. Radioactive iodine is selectively taken up by thyroid cells, where it gradually destroys overactive thyroid tissue. This treatment is widely used in adults and is considered a definitive therapy in many cases. In certain situations, surgical removal of part or all of the thyroid gland, known as thyroidectomy, may be recommended. Surgery is generally considered for patients with large goiters, suspicion of thyroid cancer, severe eye disease, or when other treatments are not suitable. Short-term iodine preparations may also be used before surgery or during severe hypothyroid emergencies such as thyroid storm. The choice of treatment depends on several factors, including the patient's age, cause of hypothyroidism, severity of disease, associated medical conditions, and personal preferences. Regular follow-up is important to monitor treatment response and detect potential complications. Main treatment options: antithyroid drugs, beta blockers, radioactive iodine therapy, thyroid surgery, short-term iodine therapy. Now that we have studied both hypothyroidism and hyperthyroidism separately, let's compare them side by side to clearly understand their differences. Hypothyroidism occurs when the thyroid gland produces insufficient thyroid hormones, resulting in a decreased metabolic rate. In contrast, hyperthyroidism occurs when excessive thyroid hormones are produced, leading to an increased metabolic rate. Patients with hyperthyroidism commonly experience fatigue, weight gain, cold intolerance, constipation, dry skin, and a slow heart rate. Since metabolism is reduced, most body functions tend to slow down. On the other hand, patients with hyperthyroidism often present with weight loss despite increased appetite, heat intolerance, excessive sweating, tremors, anxiety, diarrhea, and a rapid heart rate. In this condition, body functions become excessively active. The laboratory findings also differ significantly. In primary hyperthyroidism, high TSH, low free T4. In primary hyperthyroidism, low TSH, high free T4 and T3. Treatment approaches are also different. Hyperthyroidism is treated with thyroid hormone replacement, usually levothyroxine, whereas hyperthyroidism is managed with antithyroid medications, radioactive iodine therapy, beta blockers, or surgery depending on the cause. Understanding these opposite clinical and laboratory features is essential for accurate diagnosis and management. To strengthen our understanding of thyroid disorders, let's apply the concepts we have learned to a few clinical situations and examination-style questions. Consider a young woman who presents with weight loss, palpitations, heat intolerance, tremors, and protruding eyes. Laboratory tests reveal low TSH and elevated T4 levels. The most likely diagnosis is Graves' disease, which is the most common cause of hyperthyroidism. Now consider a patient who complains of fatigue, weight gain, cold intolerance, constipation, and dry skin. Laboratory findings show elevated TSH and low T4 levels. These findings are characteristic of primary hyperthyroidism, most commonly caused by Hashimoto's thyroiditis. When interpreting thyroid disorders, it is important to recognize symptom patterns and correlate them with laboratory findings. Remember that hyperthyroidism causes slowing of body functions. Hyperthyroidism causes acceleration of body functions. A useful approach in examinations is to first identify the symptoms and then analyze the laboratory values. We have now completed our discussion of the thyroid gland, hyperthyroidism, and hypothyroidism. The thyroid gland is an essential endocrine organ that produces the hormones T3 and T4, which regulate metabolism, growth, development, and energy utilization throughout the body. Thyroid hormone production is controlled by the hypothalamus-Pituitary-Thyroid axis through a negative feedback mechanism that maintains hormonal balance. Hypothyroidism occurs when the thyroid gland produces insufficient thyroid hormones. This leads to a reduction in metabolic activity and causes symptoms such as fatigue, weight gain, cold intolerance, constipation, dry skin, and a slow heart rate. The most common cause of hyperthyroidism is Hashimoto's thyroiditis. Laboratory findings typically show elevated TSH levels and decreased free T4 levels. Treatment involves thyroid hormone replacement with levothyroxine. Hyperthyroidism occurs when excessive thyroid hormones are produced, resulting in increased metabolic activity. Common symptoms include weight loss, heat intolerance, excessive sweating, tremors, anxiety, palpitations, and rapid heart rate. The most common cause of hyperthyroidism is Graves' disease, an autoimmune disorder characterized by diffuse goiter and exophthalmos. Laboratory findings typically show suppressed TSH levels with elevated T3 and T4 levels. Treatment options for hyperthyroidism include antithyroid medications, radioactive iodine therapy, beta blockers, and surgery depending on the cause and severity of the disease. Understanding the differences between hyperthyroidism and hypothyroidism is essential for accurate diagnosis, proper treatment, and prevention of complications. Before concluding this lecture, let's quickly revise the most important concepts related to hyperthyroidism and hypothyroidism. The thyroid gland produces T3 and T4 hormones, which regulate metabolism, growth, energy production, and normal body function. Any imbalance in these hormones leads to thyroid disorders. In hyperthyroidism, thyroid hormone production is reduced. This causes a decrease in metabolic activity and results in symptoms such as fatigue, weight gain, cold intolerance, constipation, dry skin, and slowed body functions. The most common cause of hyperthyroidism is Hashimoto's thyroiditis. The classic laboratory pattern is elevated TSH and decreased free T4. Treatment involves lifelong thyroid hormone replacement with levothyroxine in most patients. In hypothyroidism, excessive thyroid hormones increase metabolic activity. Patients commonly experience weight loss, heat intolerance, excessive sweating, tremors, palpitations, anxiety, and frequent bowel movements. The most common cause of hyperthyroidism is Graves' disease. Laboratory findings typically show low TSH and elevated free T4 and T3 levels. Management may include antithyroid drugs, radioactive iodine therapy, beta blockers, or surgery. One of the most important examination concepts is understanding the relationship between TSH and thyroid hormones. Thank you for participating in this comprehensive lecture on hyperthyroidism and hyperthyroidism. Throughout this session, we explored the anatomy and physiology of the thyroid gland, the synthesis and regulation of thyroid hormones, and the important role these hormones play in maintaining normal metabolism and body functions. We discussed hyperthyroidism, including its causes, symptoms, diagnosis, and treatment, with special emphasis on Hashimoto's thyroiditis as the most common cause. We also examined hyperthyroidism, focusing on Graves' disease, clinical manifestations, laboratory findings, diagnostic investigations, and available treatment options. Understanding thyroid disorders is essential because these conditions are among the most common endocrine diseases encountered in clinical practice. Early recognition, accurate diagnosis, and appropriate management can significantly improve patient outcomes and quality of life. Remember the key principle. Low thyroid hormones slow down body functions, while excess thyroid hormones accelerate body functions. Always correlate clinical symptoms with laboratory findings and identify the underlying cause before selecting the appropriate treatment strategy. Continuous revision, clinical practice, and case-based learning will help strengthen your understanding of endocrine disorders and improve your diagnostic skills. The Life Science Coach. Like, share, or subscribe. Empowering learning through life sciences. Thank you.